This is how you ventilate an adult patient who is not breathing with a bag valve mask. First thing you need to do when you arrive on scene is scene safety, BSI, check the patient for responsiveness, count how many patients you have. Is it just one patient? Look, listen, and feel for breathing while checking their pulse on your side simultaneously. And do not forget to request additional EMS assistance. Now, when you're checking the person's pulse and they're breathing, make sure you don't do it for more than 10 seconds. And if you find that they're unresponsive, they're having a hard time breathing, you do the ABCs, you check their airway, and you see blood in their mouth, then you go ahead and suction. Check it out. Insert the rigid catheter without suctioning and suction on the way out. The way you'll do that is by covering the hole with your finger. Cover the hole for no more than 15 seconds on your way out. And real quick, here's the setup. Pretty easy, just plug and play. Just want to let you know, please do not let this stuff intimidate you. It's extremely user friendly, and you got this. So after you clear the person's mouth and their oral pharynx, the next thing you want to do is open the airway manually and go ahead and insert an oral pharyngeal airway. Check it out. Here's an example of opening the airway manually. When it comes to measuring the OPA, you want to make sure you get the right size, and the right size measured from the corner of the mouth to the earlobe. And what you're seeing me do here is inserting it sideways using the cross finger technique with my left hand and insert it until it rests on the lips. Now please note, after you insert the OPA, be sure that there's no gag reflex. If there's no gag reflexes, start ventilating the patient immediately while you start connecting it to oxygen, as you will see here. Notice the CE clamp with my left hand, and I'm delegating responsibility to my partner to get the oxygen while I ventilate. And when you ventilate the patient using the BVM, what you want to do is ventilate them one every 6 seconds, and then that equals up to about 10 to 12 ventilations per minute. So when the oxygen arrives, set it to 15 liters per minute, and now start ventilating the patient with the oxygen attached. The gist of it is, don't wait for oxygen to start helping. And the way you know if the respirations that you're providing are being effective is if the chest is rising, the patient's going from looking blue to looking a little bit more pink, the patient's showing positive reactions, and there's no resistance when pushing, and also equal chest rise.